Thank you for purchasing the Genteel lancing device. Genteel may seem familiar to those who have used other lancing devices before. However, there are some major differences you must be aware of to ensure Genteel works the way you expect. Genteel has 4 major parts to accomplish this: contact tips, a nozzle, the activation button, and plunger. Genteel limits how far the lancet can go into your skin by using its 6 different contact tips that have different penetration depths. A contact tip is secured to a nozzle. The activation button and plunger push the lancet into the skin and maintain the vacuum that forms the drop of blood. First, you need to prime Genteel by holding the device with the nozzle facing down. Make sure that your finger or hand is not covering the activation button. Now, push the plunger all the way in until you hear and feel a click and the plunger stays in place. Genteel arrives with the shallowest contact tip factory installed. If this is your first time using Genteel, keep the blue contact tip on the nozzle and proceed. If you have previously used the blue contact tip but have not yet retrieved the amount of blood you need, remove the blue contact tip and replace with the yellow contact tip. Make sure it is secured on the nozzle without any air leaks. Finish the remaining steps of these instructions until you get a sufficient amount of blood. You may need a few attempts to discover the correct contact tip. Twist the nozzle counterclockwise, pull off, and place aside. Insert a butterfly touch lancet. Remove the lancet's protective cap, ensuring not to bend the needle. Place the nozzle onto Genteel. Twist clockwise and ensure it's secured. Choose a test location without much body hair and with enough surface area to cover the contact tip's width to create a tight seal. We recommend your fingers or palm. If a seal cannot be made, Genteel will not function properly. Keep Genteel flush with the surface of your skin, but do not push in too hard. Use just enough pressure to maintain a seal. Press the activation button and do not remove your finger. Hold for 6 seconds or until you see a blood drop through the nozzle. If you see the red indicator stripe on the plunger while having your finger on the activation button, this means a tight seal has not been made successfully. By keeping your finger over the activation button, you are using the vacuum. This enables the blood drop to form on the surface without needing to squeeze. Remove your finger from the activation button after 6 or more seconds, which will release the vacuum. If you do form a small drop of blood, but not enough for your test meter, try using a deeper contact tip or hold down the activation button longer. You could also warm the test location beforehand to increase blood flow, or pump Genteel up and down on the surface of your skin, ensuring not to break the seal. If you remove Genteel before releasing the activation button, it will splatter the blood drop within the nozzle and there will not be sufficient blood for testing. After removing your finger from the activation button, you can now lift Genteel off your skin. Your drop of test blood is ready. To discard the lancet, twist the nozzle counterclockwise, pull off, and place aside. Remove the lancet and discard safely. Place the nozzle on Genteel. Twist clockwise and ensure it's secured for next use. Remember, if no blood was drawn, repeat these instructions with a deeper contact tip. If you run into any issues using Genteel, contact our friendly customer service team who are ready and waiting to help. Call 1-844-436-8335 or email support@mygenteel.com. Thank you for using Genteel.